that, I'm happy to take any questions.
Okay, thank you so much, Dr. Wright. So if you do have a question, remember to please submit it in the question box. There is one question asking you, if you could, to please comment about the risk of arsenic in rice.
Arsenic
do you have any information about that? In rice, there has been some notification about that, in general, and out in the media. But I don't know if you knew anything specifically about that, because rice, of course, is grown in water, and
Sure.
Do you have any information on that?
No, I don't, but it certainly would make sense if you had an endemic area of arsenic and was growing rice there, that it could certainly seep in and be part of it. That's something I would like to look into too. So.
Sure. I do just want to mention, for anybody who's interested in water and that connection to bladder cancer, we did a really interesting webinar on environmental risks that really specifically focused with a researcher from the NCI, National Cancer Institute, who spent her career researching water risks for developing bladder cancer. And she did a really interesting presentation for us. I encourage people to look at the BCAM.org website and go to our Patient Insight webinars and watch the recording on the environmental risks specifically focused on water. So thank you, Dr. Wright. So here's a question about Oncovite vitamins for secondary prevention. Do you know anything about them, and would you recommend them?
Well, I think taking a multivitamin a day is a good thing. I take one myself. As far as what specific and what levels of different things in the multivitamin, interestingly, our multivitamins now, as opposed to 20 years ago, even when they started the multivitamin study, have become packed with more and more and higher levels of things, whereas the study was more or less testing what's now a children's vitamin. So I do think a vitamin is a good thing because it helps you get the recommended daily allowance of a number of different factors that are good for you. So whether or not a specific type of vitamin with supplement, there's just not enough data to be able to say that. But again, it goes with eating a well-balanced diet and getting all of your necessary supplements.
Great. Yeah, it sounds like from the name that it's a marketed tool that's specifically saying it can prevent cancer in some way, because it's called Oncovite, but I'm not sure. I've not heard anything about that as well.
Yeah, I think I think there are a lot of those items out there, and again, I can't say they do or don't. Certainly, there's a lot of preclinical work, meaning in test tubes, where we see lots of different things that have the potential to kill a cancer cell in a test tube, and those often then get put into supplements. And we don't have studies to show a benefit or a risk, but I would say again, everything in a lot of these things in moderation, and I can't comment on anything specific along that line.
Okay. Well, here's another one that kind of correlates with what you said about healthy eating. Do you recommend eating certain foods for secondary prevention?
Mm-hmm. People ask me, should I go vegan? I don't recommend that. I think, and I don't discourage it either, but I think that for myself and what we've done in our household is again trying to really get more of our fruits and vegetables, cruciferous vegetables in particular. We've done a lot more substitution of turkey for red meat. It gives you less fat in that sense too. I try not to overcook the meat if you do eat steak, because the overcook can lead to nitrosamines that are carcinogenic. And again, I think really it'd be very difficult to never have any sugar. I like having a donut from time to time too, but trying to really limit those simple sugars that just aren't doing a lot of good for you. So, but it's okay to have it from time to time. And I do think drinking a lot of water is beneficial to just kind of flush those evil humors out. But in general, more fruits and vegetables. Most people don't get it, and a balanced diet and limiting your simple sugars. And of course, omega-3s, more fish, those kind of things are all good.
Thank you so much. And excuse me for making another shameless plug for BCAM Resources, but we did a number of different, really interesting conversations about bladder cancer, specifically with Dr. Jill Hamilton Reeves and a oncology nurse who is also a chef, Laura Pohl, and our co-founder, Diane Qualley, talking specifically about nutrition and bladder cancer. And we even have recipes on our website. So just look up the bcan.org website and look up nutrition, and you'll find that page. And there's a lot of really good resources on there as well to kind of follow up with everything that Dr. Wright has said about eating a heart-healthy diet, but also how you can do that with some good flavors and be a little bit healthier in some ways. So you can certainly watch that.
Yeah,
Move
Dr.
on to the next.
Dr. Hamilton Reeves has done some, she's leading a big study now too that we're going to be opening here as well, looking at an immunonutrition around the time of cystectomy, bladder removal, to try to reduce complications too. So some exciting stuff as well, trying to bring this immunonutrition to the forefront, and again studying it to see if it can work.
Mm-hmm. Great. You guys are doing some wonderful work out there. A question about the diagnostics. What do you think about blue light for diagnostics? Can you comment about that? Explain what it is first, but then give your thoughts on whether that's beneficial.
Yeah, so we, for standard cystoscopy, we just look into the bladder with what we call white light, a normal light source. With blue light, a compound is instilled into the bladder, and then you look in and you switch from the white light to a blue light, and it's been shown in studies that it may be able to, that it can pick up the carcinoma in situ better. It's been looked at for doing resections and being able to work toward doing a more complete resection. It's not available everywhere, and it's not standard to do it everywhere, but certainly more and more places are using it, and it's been an exciting development to have the blue light technology available. And I think I know we're gonna continue to see more and more of it. It is in the guidelines for when available to use it. So it's an exciting development, and I think we'll hear more and more and see more and more of it.
Okay. Moving on to the next question. There's an NIH study of 84,000 men that found that cannabis users had a 46% reduced occurrence of bladder cancer. Do you have any information that you could comment specifically about this?
No, actually, I'm going to look and try to find that study. I wasn't aware of that study. It's always great to hear and be directed to other opportunities to look at. So I do not have that to look at, but I will look into that. So.
Okay, great. Make a note, and if you find out anything, we can certainly report it to our listeners. Alcohol consumption and bladder cancer, is there any connection that you know of?
I think alcohol in general, any excessive alcohol intake is negatively associated with many health detriments to our health. And there's quite a bit of, there is work that a small amount of alcohol daily may be helpful or may be healthy, but you need to be slippery slope to having too much. But there certainly is evidence that resveratrol, which is one of the active agents in red wine, may have anti-cancer properties, but I'll leave it at that.
Okay, and here's one other question specifically relating to recurrence and preventing recurrence. I'm not sure if I can quite understand it. Does it make sense to have your genomic profile or your genetic testing done, especially if there's no factors that would show any risk for primary cancer in the first place, if you weren't a smoker or you didn't have certain behaviors or live in a certain area with high arsenic content in your water? Would it be something that would be worthwhile for somebody to look into? Should they do a genetic test?
Yeah, it's a great question, and we're seeing a lot more genetic testing done. But at this point, I would not recommend routine genetic testing for patients to look for a risk of bladder cancer. Now, if someone came in and we do a lot more extensive family history asking of patients when they come in and trying to identify if there may be something in the family that's passing on. So I think one thing that individuals can do is just, ask around more when you have a family reunion, or just asking the parents and grandparents, what did anybody else have any cancers? Because if there's a number of them and there's a pattern to them, then that can dictate meeting with a genetic counselor and considering genetic testing. But routinely doing it, no, I would recommend against that at this point.
Okay, thank you. I think that's a big issue, particularly, when we're in Bladder Cancer Awareness Month, that if you do spend time with your family and you have been affected directly by bladder cancer, start talking to your friends and to your family. Oftentimes I've heard from many patients that they had no idea that, grandma died of bladder cancer many years ago, because people knew she had cancer, but nobody talked about it back in the day. So the more you share that information, you'll be surprised at how many people you find, and perhaps there are people in your family. And if there's a lot of them, maybe you could begin to sort of suss out some idea about whether this was something that you were at risk for. Either it's because you grew up in the same neighborhood, or perhaps there would be something genetic. But as you said, it's really kind of an onerous task to do genetic testing just to find out, even if you don't have any real risk factors.
Yep.
Here's another question. I spray painted unprotected with enamels and lacquers when I was a teenager. Bladder cancer and prostate cancer were detected 40 years later. Is there an average time lapse between exposure and symptoms?
Yeah, and we certainly, for most exposures, it's, I would say on average 20 plus years for something to develop. And again, even though, as I mentioned, with these different exposures, we don't necessarily know that that's what caused the cancer in most instances. Now, doing that for a couple, 2 or 3 years or 2 or 3 summers as a teenager, is that enough to lead to a cancer developing 40 years later? Probably not. But then there are things like Agent Orange with exposures in Vietnam, where certainly was a pretty concentrated exposure time, which has been associated with prostate cancer and growing interest in whether it's associated with development of bladder cancer as well. Unfortunately, in most instances, we won't be able to figure out the etiology. But I would say, in general, it's 20 plus years for when we see those develop. There are exceptions, atomic bomb radiation exposures and those kind of things. But.
Okay. Well, if there aren't any additional questions, I would like to thank everybody for joining us for this program. And thank you so much, Dr. Wright. This has been a wonderful resource for us, and we will have this recorded and available online within a few days. I just want to thank again our sponsors for the Patient Insight webinar series, Bristol Myers Squibb, EMD Serono and Pfizer, Ferring, Genentech, Merck, and Photocure for their support. I'd like to thank everyone and remind you to please complete the survey. And thank you so much, Dr. Wright.
Stephanie, thank you, and thank you to BCAM for all they do to support bladder cancer awareness, bladder cancer patients, bladder cancer research, and thanks everyone for listening.
Excellent. Thank you.